In oncology, real-world evidence, or RWE, refers to evidence derived from the use and analysis of real-world data, or RWD, which are data obtained outside the context of randomized controlled trials, or RCTs. While RCTs are the gold standard for assessing the efficacy of new cancer therapies, the importance of RWE in oncology has been increasing, with the growing recognition that RCTs might not always accurately reflect the general cancer patient population. In fact, in oncology, up to 2/3 of real-world patients are not represented by RCTs. It is unclear whether findings from RCTs can be generalized to these patients, and whether real-world patients respond to treatments in the same way as clinical trial participants. Here's where RWE can help. RWE may be more generalizable to patients in clinical practice and can aid in better understanding the impact of drugs while providing information on long-term follow-up and chronic use. Appropriate use of RWE can supplement traditional clinical research to aid in clinical decision-making, offer insights into treatment selection, and improve access to therapy for underserved patient populations.